You're listening to All Things Considered on Maine Public Radio. The show continues into the next hour, and at 6:30, it's today's business news on Marketplace.
Hi, Jennifer Rooks here. To let you know that Saturday, starting at 11, we are going to re-air two of our shows from this past week. At 11, you can hear our conversation with Governor Janet Mills and Maine CDC Director Dr. Neerav Shah. At noon, tune in to hear Maine's Commissioners of Labor and Economic Development talking about financial support for Maine people. Maine Calling, Saturday from 11 to 1 on Maine Public Radio.
And you can hear today's program with Dr. Shaw and Governor Janet Mills tonight at 7. Maine Public Radio is WMEH Bangor, WMEA Portland, WMEP Camden, WMEM Presque Isle, WMED Calais, WMEW Waterville, and WMEF in Port Kent. We're also online at mainepublic.org. It's All Things Considered on Maine Public Radio. I'm Nora Flaherty. It's 6 o'clock, and in this hour, leaked internal briefings to the White House show FEMA is struggling with problems of staffing, contracting, and supplies in the COVID-19 pandemic. On Marketplace at 6:30, some farmers are losing key markets as the economy shuts down, and for farmers with perishable goods, that means they now have to dispose of their products.
I was actually on a conference call yesterday in which farmers were trying to figure out the nutrient value of milk to spread on their farms for fertilizer.
Right now in Millinocket, it's 34 with snow showers, and Bangor 36 with snow showers, and in Ogunquit 42 with rain showers. Now news. Listening to Maine Public Radio.
What we're doing is working, stay with it, even though it is a grind and even though it is difficult, we have to stay with it. We have to stay with it operationally on our hospital system, where we're coordinating statewide and what we call the surge and flex system.
Cuomo says the state is seeing a dramatic decline in the rate of hospitalizations. The death toll from the coronavirus in New York stands at nearly 8,000. The president of Mexico says he's reached a deal with President Trump for both countries to reduce enough oil production to satisfy demands from OPEC. NPR's Carrie Kahn reports Mexico had threatened to derail an agreement to lower oil output worldwide.
President Andrés Manuel López Obrador said he had received assurances of the U.S. assistance with the oil cuts in a phone call with President Trump Thursday night. Mexico will cut production by 100,000 barrels a day, and the U.S. will add to the cut with another 250,000 barrels a day. OPEC leaders had been asking Mexico to cut up to 4 times as much. Mexico is contributing, said López Obrador, but a nearly 25% reduction was too much to ask, he said. Worldwide demand for oil has dropped dramatically due to the coronavirus pandemic. Mexico's president has made boosting oil sales a big source of national revenue, one of his major policy goals since taking office in December 2018. Carrie Kahn, NPR News, Mexico City.
Italy is extending its nationwide lockdown for another 3 weeks amid the coronavirus outbreak. NPR's Sylvia Poggioli reports businesses and factories have been shuttered for nearly a month, crippling the nation's economy.
Prime Minister Giuseppe Conte told the nation the most stringent lockdown in a Western country will be extended at least until May 3rd. Otherwise, he said, we would have to start from scratch with more and more deaths. Already, Italy's death toll has reached almost 19,000. Conte also excoriated Italian right-wing opposition leaders for false statements on the partial agreement reached by EU finance.
Because NPR News, Washington.
The Trump administration and congressional leaders are expected to launch a new round of talks on an additional coronavirus relief package. Top Democrats say the White House has agreed to pursue bipartisan negotiations on an interim bill to replenish a $350 billion paycheck protection program for businesses. You're listening to NPR News in Washington.
And at 4 minutes after 6, I'm Nora Flaherty with this Maine news. 17 people in Maine have now died from COVID-19, and Maine Center for Disease Control Director Dr. Nirav Shah says 57 people are now hospitalized with the illness. The total number of confirmed cases in the state is 586. Maine healthcare providers are getting $145 million from the federal government as they focus on pandemic response while many of their usual revenue sources have dried up. Senator Susan Collins and Angus King announced today that 1,681 Maine providers would get a share of those funds to reimburse them for healthcare-related expenses or lost revenue attributable to COVID-19 and help prioritize COVID-19 testing and treatment for the uninsured. The state's largest provider network, Maine Health, has canceled elective procedures while maintaining pay for its workforce. Spokesperson Katie Fulham-Harris says the funds will help to make sure the nonprofit has the means to make critical decisions in the coming weeks.
But there will be substantially more support needed for us to be able to return to a state of providing the comprehensive care and ensuring that all of our patients have access to all of the services that they need in the future.
Fulham-Harris says Maine Health is losing money at a rate of approximately $85 million a month right now. Congress has authorized additional funds, but they have not yet been allocated. In weather tonight, snow showers in the mountains, otherwise skies clearing somewhat and winds calming down. Lows in the mid-20s to the low 30s. Tomorrow, partly to mostly cloudy and windy with highs in the low 40s to the low 50s, and on Sunday, partly sunny and quiet. Overcast west and south late with highs in the mid-40s to mid-50s.
Support for NPR comes from NPR stations. Other contributors include the Candida Fund, supporting individual dignity and sustainable communities through investments in transformative leaders and ideas. Learn more at KENDEDAFund.org and Americans for the Arts.
All Things Considered is made possible by your support and by Pharma, America's biopharmaceutical companies, committed to beating the coronavirus. Updates from these companies are available at pharma.org/coronavirus. And by Husson University, committed to strengthening Maine's future by preparing business, health, and communications professionals of tomorrow. Husson.edu.
It's All Things Considered from NPR News. I'm Ari Shapiro, broadcasting from my home studio in Washington.
And I'm Mary Louise Kelly at NPR headquarters here in Washington. When will things get back to normal? It's the question on the minds of every American, including those working at 1600 Pennsylvania Avenue. The date, May 1st, looms large. That is when the current social distancing guidelines are set to expire. Surgeon General Jerome Adams on Fox News this morning said that would be too soon.
Some places will be able to think about opening on May 1st. Most of the country will not, to be honest with you, but some will, and that's how we'll reopen the country, place by place, bit by bit, based on the data.
For his part, President Trump has mostly stopped naming specific dates after his earlier goal of packing churches on Easter Sunday proved unrealistic. He has not been shy, though, about saying it's a priority to get the economy going again.
This country was meant to be open and vibrant and great, not where people are, staying and, I would love to open it. I'm not determined anything. The facts are going to determine what I do.
All right, so to talk more about this tension between stopping the virus and getting the country back to work, I am joined by NPR White House correspondent Tamara Keefe. Hey, Tam.
Hello.
Walk us through where the president has been on this question of how and when to reopen the country.
Less than a week ago, he was repeating his line that you can't let the cure be worse than the disease, saying that you just can't have this shutdown continue. But then he has shifted again. He has been saying that it will be back to normal sooner than you might expect. He's been cheering the models that say that the death toll may be closer to 60,000 than 100,000. Members of his administration, like the Treasury Secretary Stephen Mnuchin in a cable hit, said a May 1st opening would happen. But then today, President Trump was asked if on May 1, health advisors tell him that it's too soon, whether he would listen to them. And he said, yes, he always does.
We're going to go back to work and we're going to stay healthy. And staying healthy is also a proportion. If you look at what we're doing, we're looking at a date. We hope we're going to be able to fulfill a certain date, but we're not doing anything until we know that this country is going to be healthy.
And that's the thing about President Trump in terms of these big decisions like the social distancing guidelines or telling the public to wear masks when they go out. He makes a lot of noise. He complains about the downsides. He says he won't personally wear a mask. He says the social distancing is killing the economy and he doesn't like it. And then he listens to the health advisors and goes with the guidelines.
Well, so what are his health advisors saying at the moment?
Well, they are seeing positive signs that the social distancing is working, but they also say that doesn't mean that it should stop. Dr. Anthony Fauci at today's White House briefing made that clear.
This is not the time to feel that since we have made such important advance in the sense of success of the mitigation, that we need to be pulling back at all.
It's really important to note that, one, there are 20 days left in this 30 days to slow the spread, but also when it gets to the point that the health advisors believe that it is safe to start having people return, it's not like it's going to be flipping a switch. It's not like President Trump is one day going to say, okay, go, return to normal, and everyone will just walk out of their houses and start hugging people.
Yeah.
From a public health perspective, this is likely to be quite gradual, as the Surgeon General said, not all places all at once. Until there's a vaccine, there will be a new normal, and it won't look like what it did before we all locked ourselves in our homes a month ago.
Yeah, and let's just focus on this tension, or is there a tension between opening the economy and keeping Americans healthy?
You know, there is certainly a rhetorical tension, and there's even a tension in sort of the way President Trump talks about it. But it's not clear that there truly is one in terms of how it will turn out. President Trump has his coronavirus task force. Today, he said soon he will be announcing another task force.
This is really, I call it the Opening Our Country Task Force, or Opening Our Country Council, so we don't get it confused with Mike's task force, which has done so great. And we're going to have the great business leaders, great doctors. We're going to have a great group of people.
Yeah, and that group of people will also, he says, include governors and scientists. And the governors and the scientists may have a lot more say in how this all turns out. And when various cities and states reopen than anything President Trump says.
NPR White House correspondent Tamara Keith, thank you.
You're welcome.
The Trump administration has enlisted some of the biggest corporations in America to help boost the supply of medical equipment needed to fight COVID-19. But many of those supplies still are not going to where they're needed most. Instead, the marketplace and long-established business ties are shaping who gets life-saving equipment and who has to wait. North Country Public Radio's Brian Mann reports.
When the COVID-19 pandemic exploded, many governors around the U.S. expected the federal government to rush medical supplies to growing hotspots like New York City. Here's Governor Andrew Cuomo of New York.
When I was in the federal government, FEMA effectively was the shipping clerk. They did the purchasing, they disseminated to the states.
FEMA is doing some of that, but the Trump administration has shifted much of this effort to 5 big medical supply companies, including McKesson, Cardinal Health, and Illinois-based Medline, where Jesse Greenberg is a spokesman.
We operate about 50 distribution centers in the United States. We have about 22 manufacturing facilities. We're doing our very best to step up to this challenge.
The theory here is the medical supply shortage is vast, too big for the federal government to handle alone. The U.S. needs these corporations digging in, getting creative to ramp up shipments fast.
It's totally unique. I do not remember anything like it before.
Eleanor Fox studies trade regulation at New York University. She points out the Justice Department issued a formal letter last Saturday allowing medical supply companies that are typically competitors to collaborate in ways that would normally violate antitrust laws.
It would probably be an illegal cartel, but for the fact that this is a crisis.
Company executives interviewed by NPR say they're already accelerating deliveries, expanding the overall supply of medical equipment. They also say safeguards are in place to prevent them from price gouging during the pandemic. But this arrangement has infuriated many state leaders. That's because the majority of supplies procured by these companies aren't being handed out on the basis of need. Instead, they're going to the company's regular customers, even if they're not in a COVID-19 hotspot.
We have existing contracts.
Jesse Greenberg with Medline says as the pandemic escalated, his company actually stopped taking new orders from frontline health providers, even those facing dire shortages of protective equipment.
The inventory isn't there for Medline to service new customers in a way that would damage or lessen the amount that another customer would get, existing customer.